everyone! This is a video I've wanted to make for a while, but I don't really have a good introduction, so we'll just jump in. This is broken down into 4 parts, and you can find those chapters in the details section below. The first part is about free will. The second part is about the brain being just another organ. The third part is about misunderstanding the diagnostic criteria. And the fourth part is sort of a so what, or what do I do now with this information. With that being said, if you hear any running around, that's going to be one of my cats. She's got the zoomies. Nothing I can do about that. Cats just kind of do what they want, right? And that brings us into part 1 about free will. I'm not going to talk about the existential concept of free will and what that really means, or if there's any kind of religious concept or the moral implications therein. What I'm talking about is something that most of us can grasp. Most of us can have a discussion about. When we think about the brain, for some reason, people really separate it from your personality. That there's this idea that your brain is, well, yeah, it's that thing that stops you from dying. It's the thing that, keeps your heart beating and your lungs moving while you're sleeping and stuff. But otherwise, your personality is like this separate entity, and all the things you do in the day are things that you do because you will them so. For example, this morning, I wasn't dying of thirst, but I did choose to drink something. I willed myself to drink something. And I had some options. I got a lot of different stuff in my house. I could have consumed tea. I could have consumed my beloved Diet Dr. Pepper, or I could have consumed the thing that I usually consume in the morning, which is coffee. And so I willed myself to have coffee. I didn't have to add sweetener, but I willed myself to do so. I didn't have to put in a splash of oat milk, but I willed myself to do so. And if I wanted to put in a splash of milk, it didn't have to even be oat milk. I just like how it tastes. It's not like I'm lactose intolerant. So these are all things that I did because I willed myself to do them. Another example is I don't have work today, but I willed myself to get out of bed at the same time I normally do, because I know just from past experience that it's easier for me to maintain a sleep schedule, especially when I am on vacation, even things like summer vacation. I'm a teacher, we have summers off, and I try to keep that same schedule because I just find it works out better for me. And I found that out from experience. So it's not that I necessarily want to wake up at 6 a.m., but I will myself to do so because I know from experience that it just makes more sense to do this. I tend to get more done throughout the day. I'm able to get in my exercise in the morning. And also, when I do go back to work, it's a lot easier to adjust to a sleep schedule if you've never changed your sleep schedule, right? And so we think of these things as anything that happens in the day, we've willed it to be so. Like any of our behaviors, not somebody else's behavior or the weather, but something that I chose to do. To get us to the concept of mental illness and how that's not part of our will, I want to talk about alcoholism or any other substance dependency. The way that you can kind of understand this, if you've never dealt with substance abuse, is that your brain tells you that you need to have certain things inside of your body or you will die. So you need oxygen inside of your body or you will die. You need water inside of your body or you will die. And it keeps sending you stronger and stronger signals until you end up satisfying that desire. So if you're thirsty, and you kind of just start off with that little bit of thirst. But as you continue to ignore that thirst signal, your body starts sending you stronger and stronger signals until you get to a point where you're pretty much willing to drink anything. And that's why we have those reports of people drinking their own urine in really dire situations. And that's kind of what happens when your body gets dependent on something like alcohol or methamphetamines. Your brain is now telling you, you need this in your system. And the longer you go without having it in your system, the stronger that your desire becomes. So the stronger that notification is. And it starts to kind of override your desire to think rationally. So if you are deciding to quit and you want to do it cold turkey, you don't want to taper off, you want to do it without any outside help or checking yourself into a rehabilitation clinic, for example, and you just say, you know what, I'm tired of this. I know that I no longer want to drink alcohol. I'm going to quit drinking. This is when you're at a point where you don't have that desire for alcohol. It's like when you chug 2 liters of water, you kind of feel like, oh, that's it. I can't drink any more water today. Or when you have a really big meal, you say, oh, I'm done eating forever. Now, of course, you don't really mean that, but it's sort of that idea that I'm totally satisfied. My brain is not telling me to put any more water into my system or to put any more food into my system. And in a similar way, you've gotten to a point where your brain says, we're good on the alcohol, or we're good on the methamphetamines, we're good on the opioids. At that moment, you can kind of think clearly. And you can say, you know, this isn't really good, it's a waste of money, my health is bad, it's interrupting my ability to have normal relationships with the people I love, I'm going to give this up. But then that feeling starts, that kind of hunger. And as this hunger grows for these substances, it starts to override what you and I would consider, just for, casual purposes, our concept of will and our concept of free will. You may freely choose to say, I don't want to have alcohol when you've had your fill of alcohol. But when your body is telling you you need to get this in your system, this starts overriding your will. It's the same idea that you would never want to consume a loved one. But in these really dire situations, such as the Donner Party, which if you guys don't know, because I have a lot of international viewers, this was a group of people that were going from the eastern side of the United States to the western side in the 1800s, and they got stuck in this mountain pass. And it was very snowy, they got stuck there, they ran out of supplies, they started burying people, but they realized if they were going to survive, they needed to consume people. And one of the things they did was they tried to label who was who, so you wouldn't be consuming your own father or your wife, but otherwise you would have. And this came long after they did things like eat their books and boil their shoes and eat those. This is something that, yes, they really didn't want to do this, but they had to. This overrode their will. And I know if you've never had substance abuse or understand substance abuse or seen substance abuse disorder, if you've never encountered this, it can be really difficult to try to liken the two. That your desire for an opioid drug is as if you are starving to death. But that's the part about the brain that we forget. Whatever the brain tells us is reality, that is reality. If the brain is telling me I need to get more methamphetamines in my system, it doesn't matter that objectively I don't need this. What matters is my brain is driving me to do a thing. Now we can think about this with like substance abuse. We can think about this as the brain's chemistry being hijacked by some outside force, such as, for example, again, methamphetamines. But this is where part 2 comes in, that the brain is just another organ. We don't really think about people who have diabetes as people who have willed themselves into diabetes. We don't think they can get out of it by willing themselves out of diabetes. You cannot will away autoimmune diseases. You cannot will away things like pancreatic cancer. You can't will these things away. These organs have a function. They have to put out a lot of hormones, or they produce chemicals that help your body function normally. And when they malfunction, this is not a problem of will, this is a problem of it's a machine that sometimes breaks down. Sometimes you can put yourself in a situation that if you don't really understand what's going on in a person who really has a disease, you might think that maybe I have this disease, especially if you never got it checked out by a doctor. And so if you make some changes and you feel better, you might think, oh, I overcame this disease. And this is where we get a problem when people, quote unquote, feel depressed because they have a really poor diet, they have a really poor exercise regimen. They don't really go outside and interact with people. They don't go outside and get that precious vitamin D from the sun. And they believe that they have depression. They have some symptoms that might mimic depression. They do feel differently than they did in the past, which is one of the ways that you might start seeing a doctor asking about hey, is there something going on? Maybe I have depression because I used to be not this and now I feel this way. And so you may believe and self-diagnose with depression. Then you start changing how you eat, you start changing your exercise, you start going outside, and you start feeling better. And then you decide, I've cured my depression. That's all depression is. And I actually did have someone tell me that depression just means deep rest, son. And so if you just get proper rest and proper sunshine, then everything's going to go away. And that's kind of like if you had a really high sugar diet and your stomach hurt and you felt really sick kind of every day because you were just eating too much sugar. So you decide to change your diet and stop eating so much sugar. Then you feel better and you say, oh, I cured diabetes. You were never diagnosed with diabetes and you didn't cure it. You just were having a lifestyle situation that you fixed. So the brain is an organ. It responds a certain way to outside things that we put into our body, not just things like alcohol, but stuff like, are we eating healthy food? Are we drinking enough water? Are we getting enough sleep? Are we getting enough exercise? Are we getting enough vitamin D, for example? But the brain is also an organ in that sometimes it does just mess up. Sometimes you're born with it messed up. Sometimes you develop type 2 diabetes, and sometimes you're born with type 1 diabetes. That's just how it is. The human body is interesting because it's so complex. There can be two people, like two friends, and they decide to embark on a certain kind of diet, and one of them will lose a bunch of weight and one of them won't. They might lose weight, but they lose it a little bit more slowly. I remember going to the gym and doing this thing called a 5 of 5, where it's a type of a bodybuilding regimen. And I went in with this man. So I thought he's going to make so much more progress than I am. And I was making more progress than he was, which was really bizarre that I kept adding weight to my lifts pretty much every week and he just couldn't. That doesn't mean that that's going to be the case with most men or most women, but it was the case with him. And I tried everything to help him out and nothing worked. It was just a really bizarre situation. There's some people that they may drink lots of alcohol and they have a friend who also drinks lots of alcohol, but they develop liver cirrhosis and their friend doesn't. Or people that maybe smoke roughly the same amount of cigarettes per day for the same amount of time, one of them develops lung cancer and one of them does not. So in a similar way, two people may encounter a really traumatic situation and one person says, this sucks, but I'm glad it's over, and the other one may develop post-traumatic stress disorder or PTSD. And so this is how the brain can respond in different ways, and it doesn't mean that one person willed themselves into PTSD or they're too weak to will themselves out of it, just like a person didn't will themselves to develop lung cancer or they lack the will to undevelop the lung cancer. So it's just another organ, and I think that a lot of people forget that. For part 3, there's a misunderstanding of the diagnostic criteria, and one of the ones I want to look at is depression. There's an idea of what depression looks like. We see it in some movies where a depressed person kind of stays in bed all day, or if you've had any kind of health class when you were in high school, they talked about depression as like feeling really down. What does that mean, right? Or we think about depression as someone who just can't really function in society. They're so busy crying and feeling this deep despair all the time. They don't know how to maintain proper relationships and they just can't function, essentially. They're just stuck at home, in bed, until they eventually take their own life. And that's kind of how we see depression. The other problem too is that, again, some people think they have depression, they don't. They just aren't eating healthily. And then they think that they've fixed it. Or they have depressed feelings because of some outside force, like a death in the family. And yeah, that's really awful, and that definitely will trigger those depressed feelings, but those depressed feelings eventually subside. It's not that the sadness of death ever goes away, but that sting kind of does a little bit. So you kind of go back to not normal, because, you know, I've experienced a death in the family, and it's hard to say there's a normal feeling after that, but you kind of go back to your day-to-day life, where you're not constantly sobbing all the time. But when we're talking about something like clinical depression or persistent depressive disorder, major depression, when we're talking about something like that, these not only look different than we would expect, but they're also not caused by some outside thing. If, like, for example, when my sister passed, I cried lots and lots and lots. But this doesn't mean that I had depression. I was feeling depressed, but it didn't mean I had depression. There was something I was reacting to. With depression, with like clinical depression, major depression, etc., the psychological depression, this is something that is sort of a state of existence. There's nothing outside that any other person would say, oh yeah, I can see why this would be making you feel down. If I mention, because I mean it is around that time of the year, if I mention about my sister's death anniversary coming up, people can understand why I'm not feeling that great. But without that outside force, and I just say I'm just feeling down, and everyone asks, well, why, what's wrong, what's up? And I say nothing. Everything's normal, everything's fine, I just feel down. This is something that is indicative of depression. So let's look at what the DSM-5 has to say about this. In a future video, I'll talk about why these need to get updated, but DSM-5 means there was a DSM-4, a DSM-3, etc. And there are also things like the ICD-10, which was the ICD-9, which was the ICD-8, and there are those other diagnostic options, but this one I want to use just because it included pretty much everything I wanted to discuss. So the first one is when we're talking about major depression and we're listing the symptoms. First of all, a lot of people will skip this top part, which basically says you need 5 or more of these recurrent symptoms, and one of those symptoms is one of these. So it has to either be depressed mood or loss of interest or pleasure. And those are the first 2 that are listed. The rest of them have to be occurring at the same time, and they represent a change from previous functioning. The reason I bring this up is a lot of people will look at this list. They kind of skip that beginning part. They look at this list almost as if it's a quick reference, and they say, oh, you know, I've been sleeping a lot and I feel a loss of energy. Oh, so what? They're gonna diagnose me with major depressive disorder anyway? No, I know I'm this way because of my medication. Yeah. That's why at the bottom here it says the symptoms are not attributable to the psychological effects of a substance or other medication, and also that they can't be better explained by something else. So if you talk about something like hypersomnia, which is sleeping in excess, and feeling a loss of energy, this may be indicative of some other problem. And that's why it's saying this is not better explained by some other problem. One of the depressed feelings that they're talking about here, they're talking about feeling sad, but they're also talking about feeling empty or hopeless. This empty feeling, I would say, is pretty typical of a depressed person that exists among you. So this is a person that has depression, but you would not necessarily peg them with depression. These are people that function typically in society. Now, yes, you can feel sad and still go about your daily life, but usually feeling sad is accompanied with something like looking sad. Whereas feeling empty being accompanied by looking empty, what does it mean to look empty? It's usually just a blank expression. So if somebody walks into my classroom, for example, and there's nobody else there, I have a blank expression on my face, they're not going to say, wow, Lee feels empty. They're going to say, oh, hi, sorry to bother you. They're not even going to notice that there's anything going on. The other thing is that this is either subjective report or it's an observation made by others, usually people that you are in close, frequent contact with, such as close friends, a roommate, a parent or a child, or somebody that is like a romantic partner. The other one here, this markedly diminished interest in pleasure by all or almost all activities nearly every day. This doesn't mean you can't do the activities. It just means that you no longer have pleasure. So you can still tell yourself, well, I guess I should keep at my painting if you have painting as a hobby, because I don't really have anything else to do and I'm not really tired, so I guess I'll just keep painting. This doesn't mean that you're taking pleasure in it. So again, that's another misconception, is this idea that depressed people don't do anything. They have no hobbies and they never participate in their hobbies. Sometimes a hobby can be engaged in as a way to just kind of pass the time, or because you feel like, you know, this depressed time is going to pass. I'm not going to feel as depressed. I'm used to feeling up and feeling down. You know, I'm just going to do this because it's better than nothing. Significant weight loss or weight gain, or a decrease or increase in appetite. And then below that we have insomnia or hypersomnia. So it seems a little weird, insomnia or hypersomnia, increase in eating or decrease in eating. How come it's not one or the other? Or how come it's not one and not the other? Why is it one or the other, and both of these can be indicative? It's because there's not just one way to have depression, for example. So the different kinds of hormones, neurotransmitters, and other chemistry that we have going on in our body, it's responsible for more than one thing. A good example is magnesium. Some of you might be supplementing with magnesium to help your muscles relax, and some people might be supplementing with magnesium to help their muscles not be in so much pain, and some of you might be supplementing with magnesium to help avoid or manage migraines. It doesn't mean that magnesium, these claims are all lies just because they have different functions. It just means that it does different things in the body. And in the same way, there's different ways that your body experiences depression, or that your brain produces depression. There's different ways that the brain produces ADHD, for example. There's different ways that my cat won't shut up. Since you're hearing him talk so much, I thought maybe you'd like to see him. This is the one that demands the waters being separated from the waters. And he's normally not this cuddly, but he seems to be very, very in need of attention. All right. So, no, now he's not. Okay, there you go. Alrighty. Puh, cat hair. These hormones in your brain, or these neurotransmitters, these chemicals in your brain, basically they have other functions as well. And there's also different ways that your brain can experience these things like depression. So for example, if we want to call it like the happy neurotransmitter, the happy chemical, if your brain doesn't produce enough of these, then you're going to have depression. But your brain might produce enough of these chemicals, but they're just not received on the other end. And that would also produce depression. And sometimes it's both. You're not producing enough and you're not receiving them properly, so that also results in depression. But we can see how that, if those happy chemicals are responsible for other things like appetite or regulating sleep, we can see that different kinds of depression are going to lead to different kinds of appetite or sleep issues. This other one here, psychomotor agitation or retardation nearly every day. This can be subjective, but it needs to be objective. So it's something where if you went in by yourself, you would say, my friends keep telling me that I'm a lot slower. I don't know what it is, I'm just feeling that way. Or you might have your partner noticing that you're moving around a lot, but not really doing much. So you kind of might be pacing back and forth, and they ask you, what's going on? This is a bit of a change. And you just say, I don't know, I just feel like I can't sit down. Another one of these symptoms that's really misunderstood is fatigue. Fatigue is not, oh, I've been busy today, so I feel pretty tired at the end of the day. It's not something where you had a really busy weekend and so Monday when you go back to work, you're already a little bit tired, or where you messed up your sleep schedule and you drank too much and then now it's time to go back to work and you're just really groggy. That's not what we're talking about by fatigue. We're talking about for no other reason that you can identify. So it's not that you're on a diet and just not getting enough calories. It's not that you drank too much and you have a hangover. It's not that you're sick and that's one of the symptoms of a flu. It's that for no reason that you can really point to, you've just started sleeping in the middle of your day. And I don't mean something like taking a nap. I mean something like you're sitting down and then you realize you're waking up, that you wanted to put your head down just to rest your eyes for a second during lunch, and now you're being woken up because your lunch break is over. You totally missed your lunch break. It's that somebody else is driving, so you're a passenger, you're riding public transportation, and you're waiting for your stop, and you realize you're waking up and you've already missed your stop. This is what we're talking about by fatigue. We're talking about you are so tired, and there's no other explanation for it, that it is interrupting your function throughout the day. It is something like, oh, I need to go grocery shopping today, and I'll do that after work, and you're already really slow at work, you're already pretty tired at work, and by the time you finish work, you just go home. You just cannot walk around the store. You are just so tired. And so you say, I'll do it tomorrow, but tomorrow it's the same thing. And then the next day and the next day, and before you know it, it's the weekend, there's nothing to eat in your house, and you don't know what to do, and you think, all right, I'll just get ready and I'll go to the store, I'll go get some stuff, and just thinking about it tires you out that you go back to bed. This is what we're talking about by fatigue. And I don't mean just with depression, but also when fatigue is brought up as a symptom. A lot of people have this idea that it's just being tired. It's way more than that. It's a type of tiredness that impedes proper function in your day-to-day life. Feelings of worthlessness or excessive or inappropriate guilt, and the guilt itself may be delusional, which means there's no actual reason to feel guilty, but for some reason you just feel really guilty. A normal interaction at work, you feel like you've ruined this person's day and you feel really guilty. And again, it has to be in conjunction with other things, and it also can't be that this is better explained by some other mental illness, because this symptom does show up in other types of mental illness where you have this inappropriate guilt. With depression, this kind of feelings of worthlessness, excessive guilt, or inappropriate guilt almost all the time, this is what can make you kind of remove yourself from the situation. So if you start feeling guilty that you maybe don't want to go meet up with your friends, so you had a plan to meet with your friends, let's say you're going to a cafe, and the last time that you went to the cafe, you didn't really say much, and you just felt like you were bringing down the entire mood and that everybody hates you. So the next time that they make plans with you, you're happy to be included, but you don't want to make everybody feel like that again. So maybe a day before the plans or the morning of the plans, you cancel. But then you feel really guilty. Maybe there's something they joke about and you just feel like, I ruined everybody's plans. Maybe they were going to do something that was with 5 people, but since I canceled, now they can't do it because now there's only 4. And I'm just people think I'm flaky, and you just develop this thing in your head that's just not true. That's the delusional guilt. So then the next time that you're offered plans, you just say no thank you, and then eventually you stop being offered plans to hang out. And so you say, yeah, I knew it. Nobody wants to spend time with me. And that's better for them because, I'm just such a downer, I'm such a bad person, nobody wants to spend time with me, it's better for them. And you really withdraw yourself. As an interesting kind of note, depression is linked with Neanderthal DNA, and one of the benefits of it is that if you feel depressed, you do withdraw. So if you are withdrawing from society and you're sick, you're not getting other people sick. So that's one idea about why depression kind of stayed in the population. There's also this diminished ability to think or concentrate, or indecisiveness. And again, this is a nearly everyday thing. It interrupts your day-to-day life, and it also can't be explained by something like ADHD. And then this recurrent thought of death, not just a fear of dying, suicidal ideation without specific plan, suicide attempt, or specific plan for committing suicide. So again, these are things that may come with other mental illnesses. These may be something that people refer to as like intrusive thoughts, but this is something where it's like an almost daily thing. You're not really afraid to die. You might be afraid to mess up, and that might be why you're not doing it, but it's something that's pretty regularly on your mind. This will pop up throughout the day, for example. So again, this is not like a thought of death about a fear of dying. This is more of a thought of death like everyone would be better off if I was dead. Why don't I just do it? Oh, you're too much of a coward to do it. You know, I could just do it right now. These are things where you're walking to work and maybe you work in a building that's on the 10th floor and you just think, you know, I could just do it right now. You know, what's stopping me? Or you're thinking as you're driving to work, you could just crash your car, something like that. So these are things that are very recurrent. Notice at the end we do see that it says there's never been a manic episode or a hypomanic episode, because this would indicate bipolar 1 or bipolar 2 respectively. Now I do want to do a future video talking about how certain terms in psychology have been thrown around and really misconstrued in social media. Mania is definitely one of them. But the reason that we bring this up is to show, again, you can still have these depressive symptoms and it's not depression. So when we rule these other guys out here, that this episode is not attributable to the psychological effects of a substance or to another medication, we can't describe it better with something else like schizoaffective disorder, and also that there is an absence of mania, so it is not bipolar, and also you include 5 or more of these symptoms, and it has to include at least one of the first 2. Now we can see that it is something that becomes more diagnosable. And actually, in the rest of this, no, if you're going to interrupt, then they're going to see you. This is Chunk. This is the son of Krampus. And you can just see how big he is. Chunk found, what did you find, Chunk? Trash? You found a popsicle stick? It didn't matter all the nice stuff that I bought you. You found a popsicle stick to play with. Not that spinning running machine. Oh no, it's this little popsicle stick that you pulled out of the trash. No, look at the guilt. Do you see how they don't have misplaced guilt? Not depressed. Thank you, Chunk. Anyway, so we can kind of see here that this becomes something diagnosable, and towards the end we have this thing about treatment of this and the steps of treatment, because there are stages of treatment. But hopefully you guys can see how this is not just something where a person looks sad or they feel suicidal and so they just get slapped with this label of depression. If a person is diagnosed by a professional, they have gone through a lot of this diagnostic criteria. They also don't just get diagnosed in one go. This isn't something like a blood test. When we're looking at something like a psychological illness or a mental disorder, this is something that takes a while to diagnose. Please, please, please be very careful of any person who claims to be a mental health professional and has decided to diagnose you after one visit. That is not a person that you want to go back and see. This is something that needs multiple visits for them to develop an understanding of who you are. It would be sort of the same problem of trying to decide someone's lying because you've used these online indicators of deception. And so without that baseline, without understanding who this person is first, and their typical behaviors and the reasons for their behaviors first, it's something that you can't look at and say, oh yeah, this person is definitely lying. And in the same way, we can't say, oh, this person has bipolar 2. Not only is this something that you cannot self-diagnose, this is also something that your mental health professional cannot diagnose after a single visit. The big issue, and this kind of brings us into the last part of so what, the symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So an example of this is I noticed that I was becoming more and more upset about my sister's passing. And when I was like every year, I would just get more depressed earlier in the year. And so I eventually started seeing a therapist last year. And I remember just talking with her, and I told her that she asked me, you know, do you have any hobbies? And I mentioned that I do, and I said, you know, I have a lot of hobbies, but sometimes I just feel like an octopus, where each leg is something I want to do. It could be a hobby, it could be something I have to get done, it could be something that is like an errand that should get done, but maybe it doesn't have to get done right now. But all 8 legs are going in different directions, and so me, the head of the octopus, ultimately doesn't move anywhere because all 8 legs are desiring to go in a different direction at the same time. And as I was explaining this to her, I thought, she's going to ask if I've ever been diagnosed with ADHD. And the first thing she said was, have you ever been diagnosed with ADHD? And I told her no, and it would be one of those things where, okay, that's interesting, but otherwise it doesn't interfere with my life so much. And when we talk about ADHD, just to go a little bit back to like part 3, there's this idea that this inability to focus is associated with school. And I think a lot of that is because of how it gets diagnosed in children more than it gets noticed in adults. But this inability to focus can also refer to things like you want to take care of the dishes, but then 45 minutes go by and you're scrubbing something in the corner of the bathroom and the dishes still aren't done. Because over time you realized you needed to grab something, so you did, but then that made you think about some other things, so you started doing that so you wouldn't forget. And as you're doing this other thing, you realize, oh, I gotta go do the dishes, so you go back in the kitchen, but then you realize you have to go to the bathroom, so you do, but then you smell something in the bathroom, so you look around, and eventually it's 45 minutes later, you're in another room in the house, and you haven't really accomplished anything. And now this alone doesn't indicate ADHD, but it is what we're talking about by that inability to focus. So it's not just educational. But I mean, otherwise, it's nothing that bothers me. And so I said I don't really want to pursue that as a discussion because I don't really think it's going to be beneficial. Stuff like feeling really down and depressed, this is something that bothers me. Some associated issues, those bother me, and they interfere with my life. Now I am seeing a doctor that we're just talking. There's no medication being prescribed, mostly because I can't have medication prescribed because it interferes with the pain medication I need to take every day, and I can't take any medication for depression. I was accidentally prescribed an antidepressant, and for the first 2 weeks, it was amazing. And I just thought, wow, this is what I've been missing my whole life. Because I've lived with depression for a very long time. And over time, yeah, you do kind of figure out how to make it function. And I think that's one of the problems that as we get older, we just kind of think, well, it is what it is. We don't realize that it can get better. But then in other cases, I think especially for younger people, they're more likely to notice that this is something that could be a problem. Number one, they're talking about it a lot more. This shows up in things like TikToks and other kinds of those short form videos that really appeal to the youth. But on top of that, they're trying to figure out who they are and what does this mean for them. And, you know, being a teenager sucks. And yeah, sometimes you feel like you're out of place, and if everybody else is talking about mental health, maybe that does mean something. Kind of look at this younger person and you think, well, maybe you do technically meet some of these symptoms, but how is it interfering with your life? And they may say something like, well, it's making it hard to do this. And you have to explain that's not depression, that's just being a teenager. There's a problem with some of these diagnoses because it may make a person think that there is a problem that should be interfering with my life, and now everything gets blamed on that. So if a person feels uncomfortable, they've decided it's anxiety disorder. But then on the other side, there's people that are my age that they do have anxiety disorder, but they don't want to get it treated because there's a stigma about it, or, you know, it is what it is. I've lived with it for so long. And so it's one of those things where you kind of have to figure out, is this something that needs to be treated? And so I go back again to this idea that the brain is just another organ in your body. If you have some ankle pain sometimes, this isn't something that you're going to say, oh my gosh, I broke my ankle, I need surgery. And maybe you might take a Tylenol or some kind of ibuprofen, but other than that, it's just going to be that thing that happens sometimes. Versus when you really do get hurt. So for example, I've had issues with my back in the past, especially after the Marine Corps. But around September of 2023, I noticed there was a severe pain. There was a severely sharp pain at the very bottom of my tailbone. And it hurt no matter what. If I was lying down, it hurt. If I was getting up from a lying down position to a seated position, it hurt. If I sat down, it hurt. If I was standing, it was okay. But then my upper back started hurting. And I didn't even go see a doctor about that until it became such a problem where it was waking me up and I was just unable to get any sleep. That's when I went and saw a doctor about it. And I think most of you guys are going to have a similar feeling where you kind of ignored something until you couldn't. That's when it becomes a problem. That's when you see a doctor, and it's the same kind of thing with a mental illness. One thing we don't really talk about enough is that it doesn't have to get clinical for you to see somebody. When I had that problem at the very end of my tailbone, this is something I wrote off as, well, it'll probably go away. And then when it didn't, I wrote it off as, well, this is probably related to that other medical problem from the military. I didn't see somebody until it became incredibly painful to the point that it was waking me up every night, several times a night. And even then, I waited for a few days because I just thought, maybe it'll get better. It's stupid. But for some of us, we have a tendency to do that. And if you're like me, please see a doctor before it gets that bad. You don't get any extra points for suffering. Nobody thinks you're cool because it hurts when you walk. And in the same way, nobody thinks that you're somehow better or elevated or enlightened because you're struggling with mental issues. There doesn't have to be a mental illness, but you can still be struggling and you should still see somebody. I don't need teeth rotting out of my head before I go see a dentist. And in the same way, you don't have to be literally on the ledge before you decide, hey, maybe I need to see somebody. They're here to help you at different stages. And that doesn't mean they're going to be throwing medication at you, telling you you're crazy, and trying to lock you up. There's this misconception that everyone wants to slap you with a label, they want to sell you drugs, and they want to take away some kind of autonomy, like by locking you up if you mention being suicidal. And that's just not the case. You can freely talk to mental health professionals about this because they know the difference. They know the difference between someone who's just having a hard time versus somebody who has a mental illness versus someone who's a danger to themselves. So you can live with a mental illness just the same as you can live with a herniated disc and not really realize that there's actually a problem that could be treated. And by the time that it does become a problem, there may not be a whole lot of treatment options other than don't sit that way or make sure you use this kind of neck pillow. There may not be a whole lot of surgery options in the same way that you're not going to need electroconvulsive therapy for most kinds of mental illnesses. That isn't something to be afraid of, just like taking some pain medication so you can be more mobile or you can get some sleep when your back is hurting so much that it wakes you up in the middle of a sleep. That isn't something people have a stigma about either. And so really that's the point I want to drive home is really in part two. The brain is just an organ. It's a part of your body that is responsible for a lot. And sometimes it does stuff without us wanting it to do those things. Sometimes you develop diabetes, sometimes you develop cancer, and sometimes you develop a mental illness. Hopefully this has been helpful for you. If you guys have any specific questions, if you guys want to talk deeper about the free will concept beyond what we've talked about in this video, or if you have any specific questions or experience things that you want to share, please feel free to do so. And hopefully I can address them in a future video. Check out the other parts of the details section, which include links to things like Discord, or if you want to help me with stuff like my back pain and help me with my medication, then there's also a Patreon, and I've added a tier for $1, so as little as $1 a month, then you can join Patreon and get all the perks that come associated with that. Other than that, guys, as always, thanks for listening.